In Nepal, roughly 22 million people live without access to adequate dental care. That's about 80% of the population. This has created an oral disease epidemic that contributes to malnutrition, cardiac disease, diabetes, chronic pain, and increased risk for a variety of other illnesses. The reality is you can't have adequate primary health care without incorporating oral health care. At Jevaia Foundation, we've launched 9 rural dental clinics in government health posts by training community health workers in well-researched, specialized dental procedures for low-resource areas. Our clinics currently cover an area of about 60,000 people. Many of these people would otherwise rely on transient dental camps or mobile clinics, which, in addition to being inconsistent, neglect prevention and don't empower people with education about dental medicine. We tackle that problem by helping our dental technicians actually go out into the community, provide education and awareness, and also work with the school system to establish daily school brushing programs for children. We found that both of these things are necessary for access. There have to be services, and people have to have awareness of what those services are and why they're important. We've already begun to engage university partners in rigorously measuring the procedures that are done by our technicians to evaluate whether they are as effective as when fully credentialed dentists do the same techniques. In addition, community mobilization and education are a very important part of our work, and we assess that through surveys, which look at things like how well people understand what dental medicine is, where to find it, purchases of fluoridated toothpaste, the frequency of brushing. These are all things that we expect to see change over time. Ultimately, of course, what we would like to aim for and see is a decrease in the prevalence of oral disease in the areas where we work. And that's really a future research goal that we would imagine doing in partnership with a university. The biggest challenge we face is sustainability of our clinics. And that's something that will happen on a larger scale with policy behind it. So that involves convincing the government that this is an effective and reliable and cost-effective way to implement oral health care in the national health care system. We've actually already begun advocating for this model in all of Nepal's rural health clinics. This is me presenting this summer at the district level to officials in Nepal. And I would say we're one round of metrics away from being able to make a very strong case to bring to the government of Nepal to include this model for rural dentistry in all of its rural health posts. So imagine if we succeeded in that and the Nepal government agreed to fund clinics like these once they were established in its rural health posts. That would incentivize the international aid community, which currently puts about $1 billion a year into Nepal, to follow this lead, establish rural dental clinics like these using our blueprint. And in that case, the cost to the government of Nepal in running established rural dental clinics in all 3,000 of its rural health posts would be a meager $3 million per year. Now, the unique strength of Jevaia Oral Health Care is that this was a community response to a community level problem, and beneficiaries have been involved in its development since the very beginning. As a founder and director, I'm the only foreigner involved, and I have been spending time on and off in Nepal, intimately in rural areas for the last 14 years. I speak Nepali fluently. Our 4 full-time staff and everyone working at the village level are all Nepali. So, to achieve our vision, the next thing that we will need to do is to double our annual budget from $100,000 to $200,000 a year, and we're also looking for advisors and board members to join us. So why do you want to be involved with Jevaia? Well, first of all, nobody else is comprehensively addressing this essential gap in Nepal's primary healthcare system, and our model offers a template for rural dentistry on a global scale. But in the bigger picture, it's also challenging how we think about healthcare for the rural poor, and not only in dentistry. It's easy to congratulate ourselves for transient charitable efforts or even one-off hospitals, but people everywhere deserve dignity, and that requires innovative, systemic solutions that enhance local institutions. So as Jevaia becomes a model for human rights-based healthcare, we hope that you will become a part of our story.